Hey, good afternoon. I want to thank Caldev as well as Julie, colleagues, friends. So I'm representing Cloudbreak. I'm a part of the medical advisory board. And basically, we're going to talk a little bit for the next 5 minutes on multi-kinase inhibition. This is a new drug class for the cornea, for the anterior segment, and new indication. As far as Cloudbreak, it is a publicly traded company, so here's the forward-looking statement. So, as I said, there's been a wave of innovation in the anterior segment for the past 10 years. So I know down the hall it might seem like, you know, they've got all the action, but actually it's in here, an anterior segment. So over the past decade, there have been 6 new drug classes introduced in the anterior segment. There's been a trend that's been moving from symptomatic relief to targeted etiology management, and we believe that the next wave is multi-kinase inhibitors. Basically, these are multi-targeted tyrosine kinase inhibitors targeting vascularity and fibrosis specifically. As far as multi-kinase inhibitors, I think we're all aware of them. Some of them, for example, are vascular endothelial growth factor. We've got platelet-derived growth factor, as well as fibroblast growth factor. So essentially, in the area that we're talking about today, in the front of the eye, this is an actinic problem, UV exposure causing stem cell damage. And then this releases growth factors, that cocktail that we just talked about, those tyrosine kinases, that lead to angiogenesis or redness, as well as fibrosis and growth of tissue. As far as the multi-kinase inhibitors that we're talking about blocking multiple receptor kinase, tyrosine kinases simultaneously so that we can stop that vascularity as well as fibrosis after, for example, the stem cell damage and release of the tyrosine kinases. As far as the 2 entities that we're talking about, this is pterygium as well as pingueculae. We do have 2 strategies, 2 assets that we're looking at, 2 separate assets. These are 2 fibrovascular diseases that can be treated with MKIs. As far as pterygias in the U.S., we're talking about 15 million patients that are affected. Pinguecula, about 50 million patients are affected in the U.S. Alone. Obviously, the numbers globally are much greater. Potentially, there are other disease targets for topical MKIs, which include some of the entities that are described here: conjunctival papillomas, limbal dermoids, pyogenic granulomas, conjunctival hemangiomas, flectinular keratoconjunctivitis, and then adjunctive treatments for some neoplasias on the front of the eye. As far as pterygias and pinguecula, right now, essentially it's palliative treatments, really is all that clinicians such as myself have to offer for our patients. Eventually, we could offer, for example, surgeries, but honestly, if you speak to an anterior segment surgeon who does pterygias, we really don't enjoy the surgery. Patients don't actually enjoy the post-op either. There's a relatively high cost. Complications are relatively high, and recurrence is something that we really battle and we really can't control. So as far as the first asset, CBT-001 for pterygias, this is the phase 2 clinical results, which demonstrated disease-modifying potential. You can see in the graph to the left that you've got vascularity, which was measured. That was the primary endpoint. And you can see in the blue there's a decrease. That's the asset CBT-001 versus the vehicle, and you can see there's a statistically significant difference. And then as far as the reading center photos, which was done in a mass fashion, you can see that there's a significant reduction in the lesion length, which was agreed upon endpoint by the FDA. As far as Pinguecula, the second asset, CBT-004, is the first agent to effectively treat signs and symptoms of Pinguecula. You can see for hyperemia, there's a statistically significant difference. The study was a 28-day study, and you can see that there is statistically significant differences, and there's a reduction in foreign body sensation, which patients often complain about with Pinguecula. As far as vascularity changes, you can see that the results not only are apparent at 28 days, but also beyond up to 56 days, which is beyond the endpoint of the study. As far as the upcoming events for the CBT-001 for pterygias, as well as for CBT-004 for Pinguecula, you can see that the timeline is here. So with that, I appreciate everybody's time. The MK inhibition is a new focus for the anterior segment. It's a new class, and hopefully millions of unserved patients will be served with both CBT-001 and CBT-004, potentially being the first FDA-approved therapeutics for pterygia and Pinguecula. Thank you very much.